Okay. Good morning, everyone. Hope everyone is well and enjoying the lovely sunshine wherever you are this morning. My name is Aisling Duffy. I'm a Senior Project Manager with HSE Mental Health Operations. So I've been working alongside our colleagues here today in older persons operations within the HSE as well, to organise these webinars, and also our colleagues in the Irish Hospice Foundation and Healthy Ireland within the HSE. So thanks to those joining us today. So I'm just going to give a small background, a short background on how we got here. So I suppose it's about 7 months in the making, and my own office received funding to support nursing homes with a psychosocial focus. So one of the main things that came up really was a need for the acknowledgement and support around grief as a result of COVID-19. So mental health operations and the COVID response team within older persons, and Roisin will actually speak a little bit more about this, joined together just to kind of scope out what that would look like. We then got Breffney in the Irish Hospice Foundation on board, and I suppose Breffney has really supported us with developing the content for today, and he will deliver that in a short while. And I suppose the real focus is on supporting people working in nursing homes who have been affected by grief due to COVID-19. And I suppose we look at a wider psychosocial supports as well. And Sarah McCormack, who is a Healthy Ireland lead, will speak after Breffney this morning, and will speak about how we can support ourselves and also other supports and services that are available to us as staff. I'm conscious that we have some non-HSE staff with us today, and you're very welcome. And just to say that there may be a small number of support staff we mentioned this morning that are only available to HSE staff. However, we'd advise you to go back to your own employer to seek similar supports if that is something that you would like or require. So yeah, just to say you're very welcome. Everyone is very welcome here this morning. We're delighted to be able to run something like this and really hope that you find benefit in it. So I'll just actually go through a couple of the small housekeeping bits for the day. So the morning will run from 11, so just after 11 now, until about 12:30. So we're conscious that people will be going back to their workplaces after that. So we'll get finished up before 12:30. And just to say that if you'd like to ask a question or make a comment throughout the morning, please use the chat function, and I'll be keeping an eye on those, and I can feed that to the speakers then and to answer or comment on any of your queries. And as I mentioned there, that if there are some of the resources and that you'd like to find out more about, we will be in contact with you afterwards. I'll put together an email with different resources and possibly some of the presentations as well, and I'll send that out to you afterwards. And just to say that the webinar is being recorded, again, I'll send a link to you afterwards, and if you'd like to share it with any of your colleagues who couldn't make it this morning, I will share the link with you afterwards. So I am now going to hand you over to Roisin Maguire. Roisin is a General Manager in the Older Persons Operations Office within the HSE. So thank you very much, Roisin.
Thanks, Aisling. Good morning, everybody, and you're all very welcome to the webinar. So just to follow on from what Aisling has said there, I've been involved, as has my colleague on the webinar here, Jackie McCormack, with the National CRT Forum, the COVID Response Teams Forum, since the very beginning of COVID-19 and the response that was required from us in the health services. Within older persons and particularly in the nursing homes. And as a result of that work, there was a request from the forum to look at and give some information and materials to people on the dealing with the impact of COVID-19 and the grief that was involved in that for everybody. So that's what this morning's webinar is about. In moving forward, I want to, first of all, I want to welcome everybody and I want to thank everybody. As I say, we've been involved with the response and with the teams, the team leads of the response, as you've been involved in being the response out there since the very beginning. So I want to acknowledge all of the work that you've done over the 2 years. We've moved on from, I suppose, the real crisis and emergency crisis that was there in the beginning now, but that is what it was. It was a pandemic. It was unknown to us. There was an emergency, and a lot of people on the call this morning, you were the managers who were in the front line. You were dealing with an unknown circumstance, and you did it with great professionalism, as you always do. So it's really important that we acknowledge that to you. We've done it through the forum all the way along, but some of you we wouldn't have met before. You would have met your CRT leads, but we wouldn't have met you. So it's good to meet you this morning and to thank you for all of that. So again, this is a request from yourselves that came through to us. So we're very, very happy to respond to it. And we invite you now to take time out of the day for yourselves. This morning's webinar is for managers, both within the HSE, and I know people are joining us from the private nursing homes, and we plan to have another one for staff. And as Sarah said, or Aisling said, this will be recorded. So please just, I suppose, take time and come into the room with us now to engage in what we're here to do. Give yourself space, and I do hope that you find it constructive and helpful. We will follow up on anything that you raised today in the chat box or otherwise, and we will respond to that in whatever is the appropriate way. So we're quite happy to take any other requests from you. So thanks again, and I'll now hand over to Breffney. Breffney McGuinness is from the Irish Hospice Foundation. Yes,
yeah,
and he's going to help us this morning.
Perfect. Yeah. Thanks, Roisin. That's perfect. And sure, look, we'll let Breffney introduce himself and his role as well.
Great. Thanks very much, Aisling and Roisin. And good morning, everyone. You're very welcome. And it's a pleasure to be with you here today, looking at, I suppose, the impact of grief on you as managers, on your nursing home, on your staff, in what, as Roisin has described, has been an unprecedented pandemic, which we are still navigating, but it's a very different place we're in now to where we were over the last 2 years. And I suppose what this morning is about, as I understand it, is to take a little moment and just to catch our breath and reflect a little bit just on some of the experiences that people have had during those 2 years, particularly around the pandemic and the different experiences that each of you would have had in your nursing homes, which could have been quite challenging at times. I'd like to echo as well what Roisin said, again, just to acknowledge the tremendous work that people have done in very, very difficult circumstances. And I think that's a starting point. And you know, the gratitude that I and many other members of the public owe to you for the work that you did in very challenging circumstances. So what I'm going to do this morning is have a look a little bit at how and what we know around workplaces and grief. My role is in the Bereavement Department of the Irish Hospice Foundation. My work involves development work, particularly with workplaces, on the impact of loss and grief on staff and how we can support staff who experience bereavement, whether that arises as part of their work or whether it arises in their personal lives. So that's a large part of the work that I do. And I've been with the Irish Hospice Foundation for almost 20 years now in various roles. And my current role is, as I say, in relation to the Grief in the Workplace program, which I lead out on. My background is in psychotherapy, but don't worry, I'm not going to be psychoanalyzing you. But that's some of my background, and also pastoral care. So that's how I've come to be where I am with this and doing this kind of work. And as I say, it's a real pleasure to be working with you this morning. I hope this will be a helpful and useful session for you. And maybe what we might do just to start with, and I'm going to encourage you just to let you know that in a recording, as far as I know, none of the chat gets shown in the recording. So this won't be shown on the recording so far as I know. But I'm going to invite you to maybe just have a think about, is there one thing that you would like to get from the session today? What I'm going to be covering is a little bit on the grieving process, what we know about how grief impacts on staff, particularly in the nursing home context, and what are some of the things that we can do to support ourselves, our colleagues or staff who are reporting to us. So they're the main areas that I'm going to be covering. Within that context, is there one thing which you would like to leave with from today's session, a takeaway for you from the session? And I'm going to encourage you, if you wouldn't mind, use the chat function, and Aisling will be monitoring that, and we keep an eye on that. So maybe just take a moment and pop in what for you would be something that you would like to get from this session today. Maybe just take a moment and use the chat function if you can, and that gives a bit of an idea of what might be helpful. Okay, and just to confirm that Aisling has said to me that no chat function will be shared on the recording, so anything you put into the chat will not be shared on the recording. Okay, that's lovely. So I am going to begin by sharing some slides. And hopefully you're able to see that there now. Of course, if I went to the home button, that would be a good start. So what we're going to look at today. So I'm going to look at a couple of different areas. Firstly, just a brief look back at COVID-19 and the grieving process. What there are two types of grief, I suppose, that we think about when we think about the nursing home context, and that would be personal and professional grief. So I'm going to have a look at that. And what can help when we are grieving? What is the role of the manager in grieving? And I see that somebody has asked about, look, what kind of supports are there? How can I support staff? And that's something we're going to have a look at. And then self-care. How do I look after myself when I am grieving? And those points about minding myself and making sure that I'm okay as well. So I'm going to begin by looking at COVID-19, and you are all have been steeped in this at the front end of the COVID-19 response. I'm showing a picture here of a church in Ballally in Dublin, and in that church, when the first person died in Ireland from COVID-19, they made a small St. Bridget's cross and they put it on the outside of the door of the church. And as the pandemic progressed, they made crosses and put them on the outside of the building for each person who died in Ireland from COVID-19. And you can see, I know it's a little bit blurry on the photograph, but what you can see there is the whole outside of not just the door and not just the church building, but also their community centre and a little sacred space that they have as well is now covered with crosses from people who have died in COVID-19. Why I like this photograph is it gives us a sense of the enormity of what it is that we have been living through and living with. And sometimes it's good to just stop and remember that COVID-19 has affected a huge amount of people. It's affected all of us in some way, but for some people, it's particularly affected them. If somebody had a loved one who died from COVID-19, that's what we're seeing represented on these walls of the church. But also for anybody else who was bereaved during that time, during the last 2 years, the normal rituals and normal procedures that we had for grieving were really turned upside down, and that made it very difficult for people as well. Another reason why I like this photograph, that young man you can see at the front of the picture with the bicycle, he stops there and he stops regularly at this place in Dundrum. He's a Spanish national, and his grandfather died in the first wave of COVID. He was working here in Ireland. He couldn't get back to Spain, and so he comes to this place to remember his grandfather. And I suppose it reminds us of just how worldwide COVID has been, and that the impact of COVID stretches across nations and across peoples. So I suppose taking time to just reflect and remember, this has been an enormous challenge to all of us and an enormous change to our lives. There have been challenges and also opportunities with COVID. Some of the challenges, particularly from a grief point of view, and this would be relevant for you among your staff and also the families that you support. One of the things that we know has been most challenging in the literature is the way that loved ones have died. So, if people haven't been able to see or be with their loved one at the time of their death, that can make the grieving more challenging. Um, Even where people have been present, often they were wearing PPE. And that in itself, while it was great to be able to be there and be with the person, and it's better than not being able to be there, but you also had the complications that we have these barriers between ourselves and the person that we're trying to support as they die. Some people had to grieve alone, and that can be very challenging for people. And also, there is what we would call delayed grief. And that's where, again, for many of us, we've just been getting through the last 2 years and keeping our heads down. And a bit like Roisin was saying, there were many, many challenges, and they kept coming and they kept coming at you, and different guidance and different things you had to do. And there's a lot of fear and a lot of concern out there. Um, and sometimes when we're in those kind of situations, we do what we need to do. And for anybody who has been bereaved, um, sometimes we might just put that a little bit on hold because we have to get through what we have to get through. So that's something again that might be there for you, for your staff, for the families in your nursing home. Interestingly, there's also been opportunities, which might sound strange to talk about COVID as an opportunity, particularly around grieving. What it has given us, ironically, is more openness to how death and grief affects people. Death has become front and center because of COVID, not just in Ireland, but right across the world. And how we respond to death and how we think about death, how we think about grief, particularly for staff and how it can impact on us. I think there's a much greater openness to that now. Interestingly, some of the studies coming out of China, Italy, and Greece around the impact on healthcare staff of the COVID-19 pandemic have thrown up some very interesting results. Some we would expect that some people have been traumatized and some people have found it very difficult. But what has been surprising is that many people have found a new sense of value in their work, of being valued, and a sense of being part of something, even though it has been very demanding and very difficult, but being part of something worthwhile in terms of trying to provide care to people in very difficult circumstances. There's one study from China which covered, I think, around 48,000 nurses who were involved in frontline work with the first wave of COVID. And what they found that the level of post-traumatic stress was similar to SARS and what was expected. What wasn't expected was what they call a large increase in compassion satisfaction, where nurses were reporting that they found a satisfaction in being able to help and being able to do their work in a worldwide pandemic. There can be a greater sense of community. I'm not sure what your own experience of that has been. We certainly found it in the Irish Hospice Foundation. Barriers which had been there just fell away. Greater collaborations evidenced by what we're doing here today, working with the HSE. We set up a bereavement support line with the HSE. So there were a great sense of professional community, but also personal community. I know I live in Clontarf in Dublin, and I got to know my neighbours much more than I would have ever before. And that was lovely. And that has persisted as well in terms of once we've moved out of COVID. So it's brought challenges, it's brought opportunities as well. It's good to be aware that even though we're coming out of it now, and rightfully so, we're rightfully kind of enjoying things that we couldn't enjoy. I mean, if you think about it, it's ironic that this year we're having trouble at airports because everybody wants to get away. We couldn't do that last year or the year before. So it's great that we can do that. From a grief point of view, we have to be mindful, though, of what has happened. We have to be careful not to move too quickly away from that reality. Time and give our staff and give our families and loved ones the chance also to process some of what has people have dealt with and indeed are still dealing with and will be dealing with on an ongoing basis. So just in terms of looking at loss and grief, what are we talking about? I mean, particularly in terms of the deaths, there have been a huge number of deaths from COVID. And how does that impact on people? Again, one of the things I said there that's going to be really significant for nursing homes is the way that people died. And we know that that happened in difficult circumstances. It wasn't always perfect. And in fact, at times, it was less than ideal. And that's part of what people carry. So when we look at that kind of grief, and we're thinking about how do I support my staff, how do I support my families or other people linked with my nursing home, one of the good ways to start with this is to have a think about, well, okay, what is the key to understanding grief, whether that's my own grief, staff grief, family grief? And that is, it's understanding the significance of the loss for the person and how they experience that loss. And I suppose when we're looking at how to support somebody, that is one of the keys that we would use. What is the significance of this loss for this person, for this family, for this loved one? What's the significance for the staff member? And how can I support them in that? We know that grief is a slow and a gradual process. It's a natural process. It's a normal process. It's not a sickness or an illness. If a staff member of grieving, that is not a sign of weakness. That's a sign of humanity. So how can we support people to grieve well and healthily around what has happened? I'm going to show you a short video, and this is a video on the grieving process. And what I'd like you to do is just have a look at the video and just have a think, look, what stands out for me? There might be a phrase, there might be a concept or something in there that stands out for you. Just have a look at it and see what stays with you after you look at this video. And this is around the grieving process and having a look at how we might understand that.
Loss is losing something that is of significance. Most of us, our greatest loss will be the death of a loved one, and we will mourn that loss most of all. Donal lost his mother recently. As she was dying, he was able to be with her, hold her hand, and say goodbye. He told her that she'd been an amazing mum and had touched many people's lives. Grief is like a roller coaster. It turns your world upside down. It affects all aspects of your life and involves mental, physical, emotional, and spiritual suffering resulting from loss. It is not an illness or something to be fixed, but rather a natural process of reaction and adjustment to loss and change. This adjustment involves moving back and forth between loss coping, focusing on who we have lost, and restoration coping, adjusting to life without them. It is normal to experience a range of feelings when we are grieving. Some, like sadness and loneliness, might be
Sorry about that, just bear with me.
expected, but others, like anger, rage, and guilt, may be more difficult to accept. The aim of our grieving is to help us adjust to changes in our lives. It is not to forget about who or what we have lost, but to learn to live with those losses in our lives. It's natural to have an uneven journey with grief. Grief comes and goes like waves. There are going to be peaks and troughs, and they don't always happen in predictable ways. Some months after his mum's death, Donal hears a song his mum loved and is overcome with a wave of grief. He hangs in there and gradually the pain subsides. Remember that during loss coping, we need to be able to focus on loss and whatever feelings we experience around it, including sadness, guilt, anger, etc. But we also need to spend time on restoration coping, adjusting to life without the person who has died. Where people run into difficulties or where grief gets complicated or is stuck is when the process of moving between these two types of coping breaks down. People can get stuck on either loss coping or restoration coping. If someone gets stuck on loss coping, all they can do is think about the loss and the person who has died. They can find it difficult to get on with other things they need to do in their life. But equally difficult is where people get stuck on restoration coping and think, this has happened, I have to cut that person out of my life and forget about them, sell the house, clear out all the clothes, get rid of everything. Good bereavement care involves enabling the movement between loss coping and restoration coping. People need to do both to grieve well.
So I'm going to invite you again to use the chat function, and then I'm going to stop the presentation and just ask Aisling maybe to read through some of your inputs in terms of the chat function. But maybe just to pop into the chat function, what struck you about that video? Was there something that stood out for you about that video, and which is looking at explaining the grieving process? And I just invite you to pop that into the chat function. And then we just take a moment, and I'm going to invite Aisling maybe to do two things. One, to have a look through some of the things that you want to get from today, and we just chat a bit about that, and also then to look at your reactions to that video. And what I'm really looking at here is, look, what stands out for you? What strikes you? Does that make sense to you in terms of a grieving process? We're looking there at loss coping, being able to focus on the loss, and also restoration coping, being able to focus on how do I adjust to my life now that this person has died. And that bit, that the grieving process involves moving backwards and forwards between these two things. And that's also the way it is in the workplace. So we need in our workplaces to be able to focus also on what has happened, on the losses, and be in touch with our experiences there. And also to adjust now that those things have happened, and make the changes based on that. It's not one or the other, it's both. So I'm going to invite you, please, to pop into the chat function. Whatever struck you about that that video there. And
Hi,
Aisling,
Breffney. Yeah.
hi.
So I suppose just some of the pieces people are hoping to get out of today. So to learn more about how to control the fear of a new wave of COVID, fear of not having staff to look after the residents due to staff illness, and what supports I can offer, providing support to my colleagues as they have lost residents that essentially were part of their families and have known for a long time.
Yeah.
And then just another comment from someone is just around the supports being available when you're on call 24/7, and how we can access these supports.
Mm-hmm.
So
Yeah.
those, and do you want me to read out the new comments in around the grieving process?
I will in just a moment, Aisling,
Yeah.
just to comment on both of those. So again, look, thank you very much for sharing those comments and being so honest about them. And I think it's very good to articulate, that fear if there is a new wave. And again, just the demands on being available 24/7, like that's a lot of pressure. And I suppose it's important to be aware and to try and get supports around that, that are helpful for you. But, there's a lot obviously that has been done, but that fear of a new wave and how will I be able to manage, and what supports are there for me? It's slightly outside of the grief piece of this, but they're very important concerns to recognize. So thank you for sharing those. Yes, Aisling, great. And if we can have a look then at maybe some of the comments in relation to the video itself there.
Yeah, absolutely. So one of the comments is the importance of balancing loss, coping with restoration, and how you can get stuck in both of those.
Yes. Yeah. And we need to be able to do both. And it's not one or the other. We move backwards and forwards between the two. Yep. Mm-hmm.
And then just a comment, the grieving process go on for a very long time, and it can be triggered by memories, smells, for example. You can forget the person that is gone or what has happened over the last few years. We don't just fix ourselves overnight, and this is something the HSE needs to recognise. And sorry,
Mm-hmm.
I just you can't forget the person that is gone. Apologies, I misread that there.
Okay, yeah, that's a really good point. And there's a couple of good things in that. Yes, this is not a quick fix process. It's slow. And we can't forget that the people who have died. And one of the other comments that was there about how, staff have lost residents who they knew for a very long time, and who, I love the way somebody said it was part of their family. That's absolutely true. And we need to honor the grief of staff. We need to honor what people are experiencing. And it doesn't go overnight. And you can't just kind of forget about it. That's not what grieving is about. Grieving is about learning to live with the losses. And that means being able, as that video showed a bit, being able to dip into the loss coping and dip into the restoration coping, in and out and in and out. The other thing that I might just mention there, Aisling, is in terms of what we would call grief bursts. And a grief burst is where somebody, I think, described it, where someone there was saying that, it can be triggered by a smell or something like that. And it's almost like you're back in the place where when the person died. You're right back in that moment. We call those bursts of grief, and anything can trigger it. It can be a smell, it can be a sound, it can be a record, it can be something somebody says. Um, I know when my mom died, she died of dementia a good while ago, but I remember soon afterwards, one of my relatives, I just met them, and they were saying, "Oh, this is a rose bush that your mum had given me." And I don't know what, it just hit me, and I was in floods of tears. It was like, this was a good while after my mom died, but it just took me back there and connected me with it. That is entirely normal. That's normal grieving. And those times when we get the bursts of grief, they're normal. Staff will experience those, families will experience those. And the kind of supportive response there is simply to allow that grief burst, to support the person when they have it, not try to fix it or not try to rush in too quickly, but just to support the person. And what you'll generally find is people will self-regulate out of a grief burst. They'll come back out of it themselves if they are supported. And that support simply might be sitting down, if it's a staff member, giving them a cup of tea, just taking them to a quiet place and just being with them and allowing them to express their grief and to know that that is normal, that there's nothing wrong with it, and that's a healthy part of grieving. Thanks very much, Aisling, for that. That's
No
brilliant.
problem. There's a couple of more comments there, Breffney.
Yeah,
I'll just
go ahead.
read them out. And someone just commented, this video really accurately describes what I've been feeling over the past year since my mother passed. Thank you. And thank you for
Great. You're
sharing
very
that with
welcome.
us.
Yeah, thank you. Yeah, no
And the
problem at all. Mhm.
and the final one there is just around how to cope with the grieving process, not being so angry all the time over a loss. So I think that's just in relation to the video there.
Yeah, yeah. And I suppose the other thing is to recognize that anger is a normal part of our grieving. And that can be hard sometimes because anger and other strong emotions as well can be a normal part of our grieving. Again, just in relation to my mum had dementia. And I remember this would be about 2 years after her death. My mum died when she was 79. And I was out walking and I met a neighbor, and the neighbor is 83, 84. And I met her and we were just chatting. But she told me she had just turned 84. And the woman was as clear as a bell in her mind. And I got this stab of jealousy that my mom didn't get to 84, with a clear mind. And it's like it's totally irrational stuff. But that's what grieving is. They're very strong emotions, which we maybe wouldn't normally associate with ourselves. But that's a normal part of grieving. And it's funny, it kind of hit me in a funny way. And I thought, my God, why am I feeling that? It's 2 years after my mom died. But I think what I was feeling was the unfairness of my mom not getting 84 years and somebody else did. But that's grief. And that's what can come up. That can come up with families, that can come up with staff. And again, our role is to be supportive and not to close down those kind of feelings, but allowing them and allowing that they're normal. And that people will cope with them. Grieving isn't about not having the emotions, it's about allowing them and learning to live with them and learning to live with the loss. And it's a slow process, as one of your people commented. It doesn't happen overnight or in a couple of weeks or in a couple of months. It actually takes quite a bit of time. Thanks very much, Aisling. That's brilliant. Um, I'm going to hop on here and we'll come back to some more comments. Oh, we've done that. Right. Just something else to have a look at. Again, quick question. You don't have to put that into the chat box, but just listen to your own reaction. Do men and women grieve the same way? So just think about what your gut reaction to that is. And there's not right or wrong answer, just gut reaction to it. Do men and women grieve the same way? Because this is important, I suppose, in terms of, again, for your staff, for families that you might be supporting, or indeed in your own personal life. Generally, what we would say is that rather than thinking about grieving being gender-based, that we talk about different grieving styles. And there are two main styles of grieving that we talk about. The first one would be what we call an intuitive grieving style, and that's generally associated with the feminine or with the female. And an intuitive grieving style is a style where I process my grief by openly talking about my feelings with others. Essentially, that's a shorthand version. And I have a need and a desire to do that. That's the way that I process my grief, generally associated with the feminine. And again, that's a bit where I gather people around, or I talk about, I express my feelings openly. Maybe I cry or I do other things. Interestingly, the other end of the spectrum is what we call an instrumental style of grieving. And an instrumental style of grieving is equally as valid. I still feel the same pain of loss, but I process it differently. And I process my grief through problem solving, through activity or work. And interestingly, I don't seek out others with whom to share my grief openly. And this is generally associated with the masculine or with men, that instrumental style of grieving. The shorthand is instrumental grievers process their grief through doing. Intuitive grievers process their grief through feelings and openly expressing them. And it's a bit like you've got two ends of a spectrum, instrumental on one end, intuitive on the other. And most of us are a bit of a blend of the two, but generally we will have one style that is dominant. So what is really interesting is you can have men who are intuitive grievers. That is, men who process their grief through a need and desire to openly express their feelings. And the really interesting bit is you can have women who are instrumental grievers. That is, women who process their grief not by gathering others around, but by problem solving, activity, and work. The big point here and the big takeaway for you with your staff, with families, with anybody that you're supporting, even with yourself, is that there are different styles of grieving. One style is not necessarily better than the other. And what can be really helpful if you're in the supportive role is to think, well, look, talk to the person. It's always a good way to go. Just ask them, look, how do you normally cope with things? And how can I support you best? And listen to what the person comes back with. Some people may say, look, thanks for asking. I like to work it out myself. Somebody else may say, look, thanks for asking. I just really want to talk about my mom and what happened. And you get a bit of an idea there. For yourself, I suppose the takeaway is to be open that there are different ways of doing this. There are different ways of grieving. What's my own style? Personally, I'm kind of more on the intuitive style, but I have an instrumental piece in there as well. But knowing what my style is and knowing that my style might be different to somebody else's style, and just being open that there are different ways of coming at this grieving process. As a manager, what you can do is support whatever um, uh, grieving style a person has, and that may be different for different staff. So again, for example, if you experience deaths during COVID in your nursing home, staff may react to that same death differently. Some people may be quite affected, some people may want to talk about it, others may not. So that can be helpful to know that there are different ways of doing this, and that there isn't one right way. Okay, just another piece that can be helpful around the goals of grieving and what's the purpose, what are we trying to do? I love this image of the jars as presenting two kind of approaches to this. The first approach is what we call shrinking our grief, and the second approach is called growing our world. I'll just take the first one, shrinking our grief. That's the top set of jars. And this is like, what's the aim of grieving? What are we trying to do? And if you think of the jar as being the person, and the black ball is the grief. So if we look at the top set of jars, the one on the left is maybe at the time when the death occurs. And it's like the ball of grief fills our jar and we're full with grief. And with the shrinking grief approach, the idea was, well, look, as time goes on, let's say the second jar is a year after the death, and you can see the black ball of grief has got smaller. And then the third jar, the one on the right on the top, let's say that's 2 years after the death, you can see the black ball's getting even smaller. And the idea kind of was, well, look, as time goes on, it gets so small you hardly even notice it. But a lot of people found that didn't match with their experience of grief. And so a more helpful way of thinking about the purpose of grieving is the idea of the bottom set of jars, which is growing your world. And again, you can see that the jar on the left is the the first one is the person, the jar is the person, the black ball fills the jar. And let's say after a year, what happens? The actual black ball of grief stays the same size, but look at what is changing. The person, your life begins to expand around the grief. And then if we look at the third jar, the one on the right on the bottom, again, let's say that's 2 years after the death. Again, you can see that the black ball, or sorry, the black ball is the same size, but the jar is getting bigger. And that's a helpful way of thinking about grief and the purpose and the goals of our grieving and adjusting well. In your nursing homes where you have had deaths because of COVID, that grief is still there with you. And it's not about shrinking it or getting rid of it. It's about growing your world, growing as a manager, as a staff group, as a nursing home with the families, growing around that reality. And not forgetting about the people who have died, not forgetting about your own grief, bringing that with you, but expanding your world around it. And I think it's a nice way of thinking about grief and grieving and what we're aiming at. And it's more that idea of learning to live with the losses in our lives rather than trying to get over them or forget about them. So I want to say a little bit of that's grief in general. What about the personal and professional aspects of grief? So I'm going to have a quick look at this here. This is an article by Rabo and Huang. It's 2021. And the title of it is Witnesses and Victims Both, Healthcare Workers and Grief in the Time of COVID-19. And I suppose what they're writing about is the impact on you as healthcare staff of the COVID-19 experience and of the deaths and the difficulties. And what they talk about in this article is that healthcare workers recognize their responsibility to support the bereaved loved ones of our patients, but we must also attend to our own professional and personal grief in the COVID-19 pandemic. In the intensity and pervasiveness of COVID-19, healthcare workers' fears for themselves, and thanks again to the people who spoke earlier in the chat box about their own fears, their colleagues and their own loved ones are often in conflict with professional commitments. And I think that bit that's really important here, our healthcare systems have a primary responsibility both to prepare healthcare workers and to support them in their anticipatory and realized grief. Special attention must be paid to our healthcare worker trainees who may have not yet developed personal or professional grief management strategies and are coming into healthcare practice during a time of disruption to both teaching and clinical care. I suppose what they're saying there is the importance of mentoring, particularly mentoring around death and dying and coping with grief. So I'm going to show you again another short video, and again I will invite you after this to just pop in something into the chat box if you wish of your reaction to this. So this is grief in the nursing home.
Grief in the nursing home. There are two types of grief that are relevant for staff working in a nursing home. There is the personal grief of a staff member that arises from the loss of a loved one outside of the workplace. Then there is professional grief, which can arise as part of the employee's work in the nursing home. For example, when a resident in a nursing home dies. An employee may care for residents for a long time, sometimes years, and can develop strong bonds with them. They may spend more time with the resident than family members do. Healthcare staff in nursing homes can have a variety of reactions when a resident dies, which can include grief. Yet, family members are often seen as being the main grievers. And this is right, but the grief of staff can sometimes be minimised or discounted. A healthy workplace will recognise that employees need to be supported by their organisation around any grief, but particularly where the grief arises as part of working in a nursing home.
So again, I'll just give you a moment and invite you to pop in there. And I'm going to pop back here and just invite you, Aisling, maybe if we've any other comments that have come in there, just to check and we'll catch up on those.
Yeah, absolutely. Thanks, Bethany. So now I just want to see where I stopped. Okay, just kind of fear again there came up, and so the feeling of fear underpinned by the responsibility of residents and staff safety and how traumatic a COVID outbreak can be for all.
Mm-hmm.
And death during that time affects staff emotionally, psychologically, and they may be the only person that resident had contact with before death. As staff, we should be allowed to grieve too and should be supported with the same.
Yeah, absolutely. That's so important. And there's a couple of things in there, Aisling. The trauma of an outbreak, and that has to be recognized. It must have been and can be a very frightening experience for everybody involved. And again, as you're saying there, it does, what we know from research is that this does impact on staff. And it's not a question of an optional thing. Staff need to be supported around this. And it's a lot of the support that we need is a human response and allowing our grief and showing that is normal. Again, peer support is very important around this, and also a supportive approach from the organization around the fact that, look, staff can be quite impacted by this. The piece where, let's say, what you see in that video where the grief of the staff member can be seen as less than the grief of the family member. I mean, I found it in my own case with my own mother. When my mother died, I became the primary griever. But those people who had looked after my mum for a couple of years, they were quite affected by her death as well. And yet all of the attention went to me. We call that disenfranchised grief. It's where our grief isn't recognized as being as valid as somebody else's. And that's an important thing to be aware of. But the things that can really help around this are an awareness from managers that, look, it's important to allow our grief, to facilitate it. Again, that idea of the loss coping and the restoration coping, and that's important to be able to do ourselves. And also for staff who may be experiencing grief in different ways, and recognizing that staff can be impacted by the death of a resident. Thanks, Aisling. I don't know, there was another comment I think coming in there.
There's a couple of more comments, and I suppose just the pieces that this video is really resonating with people. I think that's really come across, and just maybe the minimization of staff grief, and you've really covered that there, Breffney. And just another kind of different comment was just around the feelings of guilt, and in particular around COVID coming into the nursing home, and how do we protect our residents and staff. Any advice regarding dealing with guilt? Now, I know this might not necessarily be in your piece, Breffney, but Sarah might be able to cover this in her piece.
Yeah, and we might come back to that at a later point. But just to say, guilt is a normal part of grieving, believe it or not. And we have to be very supportive and very careful that people in nursing homes don't carry that guilt around COVID. Around coming into the nursing home, or that we were dealing with a pandemic. But where people are experiencing that, it's really important to have open communication and support within the nursing home around that. And you might need some help and support with that. Sarah might speak a bit to that. I know there are other options that I can chat to you, Aisling, about, and we can follow up with that afterwards.
Thanks, Breffney.
Okay, right. We've done that one. So what can help when you're grieving? What is the role of the manager? What can you do to help a staff member when they're grieving, or when you're dealing with some of the things that we're talking about there with the outbreaks and that? And I suppose what we have to remember here, this would be Roisin's point at the start, you have to remember that you as a manager need to be supported as well. It's not that the managers have to do everything. You also need to be supported because you're feeling a lot of these things as well. So we have to remember that and keep that in mind. Good supportive networks and asking for support yourself is really important. What helps when you're grieving? Some of the things that we know help in the workplace are, one, allowing yourself to grieve, the kind of theme that is running through today. And that's honoring your own grief as a manager, the grief of staff, and giving permission to people to grieve. Expressing your grief in your own way. We've talked about the instrumental and the intuitive styles of grieving. Caring for yourself is really important. Simple things, getting enough rest, getting good food, Also having support, really, really important. Getting exercise. I know they're simple things, but they really make a difference. And making a priority out of care for yourself. I'll say a bit more about that in the self-care piece. Looking out for colleagues. And this is, I think, something that's especially important. We need to check in and we need to reach out to colleagues around what has happened, particularly if there have been deaths in the nursing home, if people have been maybe the last person to be with somebody as they died. Just checking in. How are you doing with that? That is a difficult experience. How are you with that? And amazingly, our colleagues, because they know the work environment and they know the demands and the pressures, they're uniquely placed to be able to offer support. So that's another thing that we know from research helps, that collegial support, and just keeping an eye out, maybe checking in with somebody, and also ourselves seeking support if we're finding things difficult and avoiding isolation. We set up a helpline with the HSE, bereavement support helpline during COVID. One of the things that we were really blown away by, the people that came onto the line, was the fact of not so much that people were saying the wrong thing to them or things like that. What people found most difficult who were bereaved was that people avoided them, believe it or not. So what I would encourage you is, as colleagues, if you've had deaths in the nursing home, just open up conversations with each other around it, and just check, like, how are you? That was difficult. How are you with that? That's important to check in. Some people might be finding it more difficult than others, but being able to share that with our colleagues can really make a difference. We have
Sorry,
yeah,
I might just
sure.
come in there because I think it's timely. Someone just asked, and you've kind of covered it there, just something really practical. What supportive words can be used by managers to help staff coping in its professional grief, with their professional grief? So just, yeah, I suppose some practical pieces there.
Absolutely. What I would say is, don't get too hung up on finding the perfect words. Trust yourself, trust your humanity, and trust your gut. So if a staff member is grieving, just go in and ask them, how are you doing? I'm conscious we've had a number of deaths here. How are you doing? How can I support you best? What would be helpful? Open the conversation with the person. Don't get too hung up on the words. Sometimes there mightn't be perfect words and it might feel a bit awkward. Don't beat yourself up over that either. But make the connection, open the conversation. So you can always say, look, I'm no expert at this, but I want to check in with you and see how you are. How has it been? You can use the facts as well. So if you've had, look, we had 3 deaths here in the last month, say, or we had 3 deaths during COVID. How are you around that? Are you doing okay? How can I support you best around that? Those kind of things would be really good. And the 3 steps I'm going to go through here, we call it bereavement first aid for the workplace. 3 steps, AVS: acknowledge what has happened. So acknowledge the losses, validate the person's feelings. So again, we saw some of the feelings in the first video of what's normal in terms of, it can be anger. I spoke about my jealousy when that I met that lady. They're the emotions that can sometimes be a bit difficult to touch, but it's validating that that is normal given what has happened. And S is for support and signpost. So support them as a manager, and signpost if you need to. If somebody is in distress, if they need more help, look to your employee assistants. I know that, I think Sarah's going to speak a little bit about some of the supports as well in the HSE. But what I would say is, don't rush too quickly over there. I would say use the support that you have. What people really want from you is a human response. And so go with that, go with your gut. And it's okay to say as well, I've been quite affected by these deaths. And I know in one of the earlier sessions we did together with the COVID response team, it was very obvious that everybody had really difficult experiences. And it was actually in sharing the reality of that people feel supported. So your role is not so much to have all the right answers, it's to be able to say, I've also been affected by this, and I want to know how I can support you. We're going to have a look at, I'm just going to go back up there, sorry. In terms of validating, you did ask for some phrases there, Aisling. So some of the things that would be good in terms of validation, There's a couple of different things here. It's normal to feel that way. It's going to take time to adjust. It's very understandable that you would feel that way given what has happened. Or this one here, which I really like, I understand this is a difficult time for you. If it's a shared death in the nursing home, if it's a number of deaths that you've had, you can always say, this has been a difficult time for all of us. I know it has been difficult for you. How are you doing? What I would say is don't get too hung up on getting perfect words. Trust yourself. Reach out to the person. That's the most important bit. Open the conversation. Be yourself. Be compassionate. Be supportive. I'm going to show you a last little video now, and this one is on the manager and the role of the manager. So again, have a look at this and see what stands out for you.
Grief as a manager. As a manager, you have a key role in helping employees who are bereaved. Employees can be impacted by either personal or professional grief, or both. Personal grief is grief that an employee experiences from losses that occur outside of work. For example, the death of a family member. Professional grief is grief that an employee experiences because of losses that occur as part of their work. For example, when a resident, patient, or service user dies. As a manager, you have a key role in helping the employee to cope with their grief, as does the organisation if the grief has arisen as part of their work. Your organisation should have a bereavement policy. It is important for you to be familiar with this and know what entitlements or supports are available to the employee who is bereaved. In responding to an employee around either personal or professional grief, a helpful approach is what we call bereavement first aid. It's very important to acknowledge what has happened and to offer your sympathies. This is particularly valuable when done sensitively by you as a manager. Try to think of what you would say if it was a friend whose loved one had died. If you cannot speak to the employee in person, write a note or send a text or email. It's important for managers to take the initiative to reach out to employees who are bereaved. When someone close dies, a range of emotions can be experienced, including sadness, anger, disbelief, numbness, or despair. As a manager, it's important to validate these emotions as a normal part of grieving. Try to facilitate an environment where these feelings can be openly expressed. Returning to work after a significant bereavement can be very difficult for an employee. They may be worried about how people will react to them, or that they might get upset. You, as their manager, can put them at ease and assure them of being supported. Let them know the organisation is also supporting them at this difficult time and what it has in place to do so. As well as emotional support, you are in a unique position to offer practical support. For example, reassigning workload or authorising leave requests. Being a single point of contact between the person who is bereaved and their colleagues can be very helpful. This allows you to communicate what the grieving person would like others to know. It is vital to use discretion and compassion when supporting people who are bereaved, especially when applying any appropriate policies. Think about your bereaved staff member and what they need from you. You may feel awkward or uncomfortable around grief. That is normal, most people do. But try to overcome these feelings and facilitate the grieving process, because you can make a real difference to employees who experience grief.
Great. So again, just as we're coming towards the end, I'd invite you, if there's any comments you have or anything that struck you there in that video, to pop them into the chat box, and Aisling will go through them in a couple of moments.
Grief.
Oops, we've done that. So the last piece that I wanted to do was around self-care, and this is so important for you as a manager, or if you're supporting somebody who is bereaved at work, or indeed if you're grieving yourself, it's really important. And I suppose it's acknowledging that grieving is hard. We've an ABC here. The B is balance in your life. So that balance of processing your grief and doing your job. And I suppose this is very relevant for all of you involved in nursing homes, and indeed with kind of worries about a new wave and stuff like that. It's important to give time to your grief and also to balance that with doing your job. It's not one or the other. It's being able to do both and move in and out of both. It's really important to have fun, exercise, and other interests outside of the grief, particularly when you're grieving or if your nursing home has had a rough run of things. If you're the manager, the good things to do can just be supportive things for staff, maybe have a coffee morning or a cake, something relaxing. That can be really good because you've dealt with really, really difficult stuff, and it's important also to be able to enjoy yourselves as a group of staff. And the C is for containment, and that's kind of, I suppose, self-reflection, thinking about it and not avoiding it, but also being able to put boundaries around it. And rituals can be really helpful for that. Um, I'm not sure what you're doing ritual-wise in the nursing homes, but with so many people dying, marking that in some way can be really good. It provides a safe way for both staff and family members to come together and remember who has died. In terms of your own self-care, I like this image of the boat. It's from Trevor Powell's Mental Health Handbook. And the idea here is to think about yourself as the boat. And in our boats, there are many different parts to our boat. We have work, as you can see, friends, children, partner, family, physical exercise, hobbies, pets, etc. These aren't all of them, they're just a few that we've put in there. But a really good thing to think about, particularly for those of you who've been kind of expressing maybe some concerns around what might be coming down the road or the difficulties that you may have. How balanced is my boat? And is there something that I could do myself to balance up my boat and to make me kind of be moving along better? The one thing I would say about self-care, and Sarah will probably pick this up in her pieces, we have to be proactive and make a priority out of self-care. A colleague of mine has this lovely phrase, we've no right to offer care to others if we can't care for ourselves. This is so, so important, particularly for those of you and all of you, I'm sure, who have come through really difficult times in COVID. You need to take care of yourself. And that means making a priority out of caring for yourself, getting enough sleep, getting enough exercise, good diet, reaching out, not being isolated. So one of the things we can do around our self-care is look at our boat and maybe over the next month or so having a think about, well, are there bits of my boat that I might like to change or I might like to adjust? What I would say is when we take care of ourselves, we give better service to others. So it's a really, really good thing to do. And it's something we have to make a priority of, particularly given what all of you have gone through over the last number of years and the kind of work that you're involved in. So just in summary from my piece, loss and grief in the workplace are normal, even though it has been certainly not normal times and extraordinary times over the last 2 years. We looked at the grieving process and the idea of grief bursts and how that is normal for nursing home staff. We looked at the idea of personal grief, so grief that goes on in the personal life of our employees, and the professional grief that arises because of the kind of work that we do. It's really important to reach out for support and to support colleagues around grief. And also that self-care is a really important part of our grieving. So Aisling, I'm going to stop there and I'm going to invite you again if there's any extra comments, maybe that we can just wrap up there around those.
I think you've kind of, covered most of them that have come in there, Breffney, and just Sarah might, in her presentation, I think she'll cover off the rest of them.
Okay.
So yeah, everything.
Great.
Thanks very much.
Okay. Thank you very much, everyone.
Thank you so much, Breffney. I've heard some of those pieces before, but it doesn't become any less powerful. And I could just sit back and listen to you all day. And just, I suppose, just the different tools we can use within ourselves are so important. But I think that word acknowledgement comes back again and again around grief in nursing homes. And the bereavement due to COVID-19 has put an extra, strain on people. And just thank you so much, Breffney, for really taking us through all of that this morning. So I am now going to introduce you to Sarah McCormack, and Sarah is a Healthy Ireland lead, national lead, and Sarah is going to speak to us kind of just around the supports that we can avail of ourselves, within ourselves, and internally and externally. Sarah, I will hand over to you now.
Okay, thank you very much, Aisling, and good morning to you all. And I want to say that it is a pleasure to be here with you. I know that some of you may have interacted with me over some of the webinars or indeed over our annual Christmas concert that we actually run. But it's great just to take this piece of time this morning, as Aisling and Breffney have said there in Roisin, just to reflect and to pause and think about ourselves and about how we can support others. So what I'm going to cover with you really are in relation to resources and thinking about protecting our health and well-being. I'm going to give you some background in relation to where that's coming from, the lessons from COVID, and the resources that are available across the HSE and available to everybody in there in relation to nursing homes, private or public or whatever, in relation to them. If there's anything that's specifically not available, I'll call it out, whatever, in relation to those. So I'll share my slides and I will start from there. And I want to say thank you very much to a wonderful presentation from Breffney, and indeed there's many of the things that I'll actually refer to. So we'll see, is this sharing at the moment? Has that come up sharing, Aisling?
Yeah, it's just coming up there now, is there? And then if you just hit share slideshow within it, it'll show it up as a slideshow.
Shouldn't it?
From the beginning, yeah.
Sure, from the beginning. Excellent.
Perfect,
Okay,
thank you.
so anyway, that is who I am. I'm Sarah McCormick, and I'm working in the area of health and wellbeing in the HSE, which is implementing Healthy Ireland. We'll talk about there just about, you will see a lot about Healthy Ireland. You probably see the advertisements on the paper, on the TV and radio and all of those, and why Healthy Ireland is so important into it. But the first thing that I will say is that I'm talking everything about in relation to health and wellbeing. Not just Breffney has spoken very eloquently there in relation to when bereavement hits and when we've had so much bereavement. But what I'm sharing with you this morning is these are the good tips and the good thoughts for us to have at any time in relation to a workplace, and how we can actually have that for a workplace or indeed outside of the workplace. So we all know that everybody says that our health is our wealth, and it's not until we start to lose it that we really start to know the benefit of it. And no money can buy our health, and we know that. But it's important for us to actually think about then in relation to, well, what is health and what do we mean by that? And Breffney has referred to that, and I'm saying to you this morning, as you sit back with me for the next 20 minutes here, think of yourself, because you always know, and here it says, is that we're no good to anybody else if we don't have our own oxygen mask on first. So everything that I'm saying here this morning, just reflect and think about, where do I fit in with this, and how is this fitting into my own life? And then I can think about workplace and colleagues and the rest from there. So it's important to think in relation to from health, is that health, it's a state of complete physical and mental and social well-being. So that's important in relation to the fact of the social and the connectivity. And that came out very strong in relation to COVID, because we know the impact of being socially isolated, what that actually did for us from there. So it's important in saying it's not merely an absence of disease or infirmity. The World Health Organization has also said that it really is important about that our health is actually being able to deal with normal stress of life, that we can work productively and fruitfully, and be able to make a contribution there into community, so that we can actually get the best out of life. And that's what I mean by bringing health together, health and well-being. And it is our physical health and our mental health coming together that gives us that zest for life, that energy, and that actually that keeps us going. And it is about us, our ability to be able to adapt within our environment. Just a note there about the state of health within Ireland, because this is about all of us. We all fit in here into this, so we can think about, well, who am I, what age am I, where am I living, or whatever else from there. Well, one of the things about the state of health in Ireland is that almost 50% of us as people over the age of 50 have now one chronic disease, and 18% more. And you're familiar with those chronic diseases in relation to diabetes, mental health, cardiovascular, in relation to those. Once you have a chronic disease, it's about learning to live with that and adapting to it all during our lives in relation to it. So we're all the time looking about trying to avoid the development of a chronic disease. And look at diabetes, is 1 in every 10 people now over 50 of age has diabetes. And they are the major chronic diseases, cardiovascular and respiratory, and they are growing at an increasing rate of 20 to 30% in the next 5 years. They're really growing at a rate of 4% every year in relation to those. And 1 in 5, and indeed 1 in 4 now, are experiencing mental health problems, and there's about 36,000 new cancers diagnosed each year. What the important message is here, and why I'm sharing those figures with you, is that chronic disease is largely preventable. And that's the real take-home message here. They are largely preventable. So, you know, sometimes you hear people say about, why do we have so many cancers now? Why do we have so much of the cardiovascular or whatever? but we have to link that in relation to our modern day lifestyle that we actually have. So you can see there that 35% of cancer deaths and 65% of cardiovascular are attributable to known risk factors. And we'll talk about those in a minute. And if we can avoid those risk factors, we greatly enhance the quality of our life from there. Coronary heart disease, which we know is increasing, but 80% of that is actually preventable. And looking at tobacco exposure is responsible for 73% of COPD. That is the reason why the Healthy Ireland framework was launched in 2013 by government. And it's a long framework taking us up into 2025, but it recognised that the state of our health in our country and indeed across Europe, but focusing here in Ireland, is increasingly deteriorating in relation to the quality of our health. Yes, we are living longer, but we are living longer with less quality to life. And indeed, you see this in the service that you're providing in relation to your nursing homes. So while you're actually looking here, think of yourself. Do I fit into this category? Am I falling into this in relation to where my age, where my chronic disease is? And, you know, they actually say that if you look at from 50 onwards, and indeed less than 50, there are few people that are not on medications in relation to their life. And this is what all of government is about now, to try to change that and bring that shift about, to get people to take more realization of the power that we actually have over our health. And that power that we have over our health comes from the lifestyle and the lifestyle behaviors that we actually are living. And of course, we know that those lifestyle behaviors are quite difficult to change, and we are inclined to go with all of the ones that maybe gives us the good things in life from there, because the environment and the modern environment is conducive to that. And we'll talk about those as we go along from there. These are the risk factors. So we all know about smoking, alcohol misuse, healthy eating, being active living, and well-being and mental health. And many of those in relation to the different things of life, in relation to healthy eating or lack of exercise, or in relation to our genetic makeup, or indeed medications that we can have, can be leading to overweight and obesity. So 25% of adults overweight or obese, so about 60% of the population now is overweight or obese in relation to Ireland from there. And that is coming very much in relation to our lifestyle behaviors driven from a modern day environment. So as you want to get healthier, you're constantly looking at, how do I live my life from there? And one of the key things here is that COVID actually has increased the prevalence of chronic disease and has increased that state of poor health for our population. And the reason for that is because we indulge more in relation to alcohol, maybe less of exercise, of what we were eating, trying to cope with stress, whatever. So we actually have a bigger mountain to climb than we actually had heretofore. But one of the things in relation to COVID that came out of this is that people themselves started to become more aware of the impact of these items on their health. Because while it couldn't come out in the early days and maybe came a little bit later on into it, was that people that smoke had poor outcomes in relation to COVID. You actually know that 89% of COVID patients that were hospitalized had obesity-related underlying conditions. Alcohol reduces the immune system, so people who were overtaken in relation to alcohol, their immune system had been reduced in relation to that. And you'll also notice now in relation to long COVID is that long COVID is actually including in there, and we're talking about it, physical activity, the importance of sleep, and the importance of healthy eating in relation to those, because this is what actually builds up our immune system and makes us strong in relation to dealing with the attacks that come on our body in physically, which affects us then emotionally as well, and mentally in relation to that. Now, from the workforce, and I just put that chart in there for you because and I have no idea of the nursing homes. I don't have any idea from your audience out here in relation to how many staff is working in your nursing homes or what the age groupings. But one of the things that's happening in relation to workforce right across the world indeed, and here in Ireland, is that we now actually have got different generations working in our workforce. So if you look at there, we have maybe the 42 to the 61-year-olds, you have the 28 to the 41s, maybe we don't have so much of the 27-year-olds that's in there. But when you as managers are thinking about your workplace, you actually then, and indeed thinking about ourselves, is actually looking to see what generation do I actually fall into. And the reason that I highlight that here, and it's very, very interesting in relation to the studies, is that the generations are actually have different qualities and different ways of approaching life. So if you look at the younger generations, and maybe that where you may be getting in staff that are the younger age group that are coming in, or you could be getting agency staff, whatever else in there, while they can be very, very, very digital aware and very, very aware in relation to education and all of those, the statistics is actually showing that from that social and from that emotional perspective, they are actually very vulnerable. So you may actually find that in dealing with younger staff, you actually have to be giving a lot more attention and reassurance and support them, recognizing what they're actually doing, than maybe what you have to give to maybe your 50-year-olds or your 55-year-olds or whatever, because it's coming from that different generation. So it's worthwhile taking that pause and say, what's my age groups in my nursing home? And then are they in that groupings of dealing with young families, of going to schools, whatever else, the stresses that may come at the various times and those, or are we dealing with more of the people that are grandparents, or maybe the people that are looking towards the retirement? So look at that in relation to from your age group from there. So 2020 brought employee wellbeing to the fore. So this is something that is coming out very, very strong. And Breffney referred to this about the change in relation to workplaces, and people now in COVID are evaluating what's the quality and what's the value that I am getting out of my workplace. And now staff are walking. And they are walking. If they don't feel that they're getting what they want out of the workplace, they're actually leaving us. And that's where we have a lot of investment in, and this is where we actually leave from there. So one of the things that is coming out right across the world and here in Ireland is that there is a big focus on employee well-being. This is what employees expect. They expect us as employers to be aware of their employee well-being and to actually support them in relation to what they're doing from their day and the environment. So are they coming into a healthy environment? Are they exposed to risks? What is the environment that they're actually working in there into it? And that will show you, that's Gallup, one of the HR studies that's done there. So I've included that in those slides, and you will have those. But you can actually see there is that organization cares about employee well-being is the number one thing that employees are looking at. So if employees are looking to take a job, go elsewhere, that is what they're looking at. It's no longer about money. It's no longer about relation to terms and conditions, because one of the things that is coming out there is stress is a huge issue that's coming from what people perceive in relation to being their workplace. And I'll refer to that a little bit later when I talk about stress. But people want to ensure that where they're working is not going to be damaging their health from their well-being perspective. Before this, we used to be talking about the dangers and from the health and safety perspective. Now it is very much in relation to from that mental health and well-being perspective. So just to share with you that when you talk about a workplace, you're talking about from an employee well-being perspective. The World Health Organization have defined this under 4 pillars in relation to that. This is what you work at from a workplace. So there is the physical work environment, right? You have the psychological work environment. You have the personal health resources. And then you have the other pieces down here about how does my workplace interact with the community? So one of the big parts out of this was that people no longer want to work in environments that are in workplaces that are damaging the community and damaging the environment and whatever else in there. And out of the HSE is developing its healthy workplace framework at the moment, and that will soon to be launched. And the delivery of the healthy workplace framework comes from the working together of our colleagues in health and wellbeing, or our colleagues, which my colleagues, myself working in HSE, Health and Wellbeing, Healthy Ireland, and in HR. And as Breffney referred to their employee assistance in occupational health, is that it is the wellbeing unit that looks at the physical work environment, ensuring that that's the safe one, that looks at that psychological work environment, and then the enterprise one is supported by both. Where I come in relation to, and my colleagues in health and wellbeing, is looking at the personal health and wellbeing resources. And this will become a little bit more clear as I go through this with you. But it is 4 pillars, and that's what delivers the workplace. To say to you as well is that at government level, that there in 2021 in December, government launched what was called Healthy Ireland at Work. And this is about now putting the big focus of health and wellbeing in the workplaces. And it has that same 4 pillars that I referred to. But the Healthy Ireland workplace is focusing on the personal health resources. It is saying that we're now in the state that health and safety is really a given in relation to workplaces. But what we now need to focus on is the environment that enables our staff and ourselves as managers to look after our personal health, and that we actually have those resources that's in there. So just in saying to you, some of you will be familiar with it. It's Dr. Linda Sisson's area under the HSE Workplace Health and Wellbeing Unit. And that is that there are many, many wonderful resources that are there under occupational health, employee assistance programs, and other supports such as coaching, whatever else is in them. Now, I usually refer, when I'm working with Dr. Linda Sisson with the colleagues, and saying that this is where we refer our employees, or we engage with occupational health and employee assistance programs when our employees and ourselves need assistance. But what we need to do is we need to put our focus, bring it back upstream, and we need to protect our employees that they actually do not need to avail of those resources. But we have built their resilience through the different programs and resources, that they are resilient in meeting the stresses, in meeting the challenges that come into their environment, and of course availing of those services when we need them. But we need to do much more about protecting our employees, as I call it, upstream. So just giving you that chart in your hand, this is where health and wellbeing comes in, and staff health and wellbeing under the personal health, which we're going to talk about, comes under Dr. Philip Crowley as the National Director. Across from there, Helen Deely is this National Director, and then these are the various programs that we work and we lead out on, and you can see myself that's there into it. So you'll see that for your information. So for some examples in relation to the staff health and wellbeing, and this is coming from looking at the personal health perspective, and I'm just going to refer to those because of the time limit, but this is to signpost you, and so that you'll actually know then where to go to from them. So the very first one that I start off with, what I believe is an absolutely fantastic resource, and Breffney referred to it, it's a program that's there called Minding Your Wellbeing. It consists now of, there's 5 video online programs, and I'm going to say to you, take note of this and make it available to all your staff and to yourself. It absolutely gets us to look and to get to know ourselves, because one of the things in relation to health and wellbeing is know ourselves. And we need to know ourselves, and then we can get to know our staff. We need to know what triggers us. We need to know what triggers our stress and how that we are. So that is a resource that is there. You will get it online, and there's also a lovely handbook that goes with that can be available to all staff, and you can actually keep your own little diary about different things. And it's really good in looking at the emotions, understanding what things are, giving you tips about improving your resilience. And one of the key things that Breffney referred there to briefly was, about compassion. We in healthcare are very, very good at being compassionate to the people that we provide services to. But all of the research shows that as healthcare workers, we are not good at being compassionate to ourselves. And when you're not compassionate to yourselves, it becomes into self-critic. And we all know about that self-critic in our head, can find 100 reasons as to why we didn't do something right, and doesn't see the many good things that we actually do. So a really good program, and I encourage you to look at that and avail it and make it available to your staff, which is all free to everybody. The other one is the stress control program. So it's about take control with stress control. And this is a program that is run out online. We run it out at different times, and it's advertised in relation to it. And it is there to help people to learn effectively ways to prevent stress and to manage stress before it becomes a problem. And it deals with people with severe and moderate and mild symptoms of stress. And it's a 6th session online, and it lasts about 90 minutes. And you don't have to go online at the time when it's running. You can actually avail of all of these as they are sitting on the website, and you can do them and make them available to your staff at any time that you want. The next one that I put up there, so you see I have done the minding your well-being and the stress. The next one that I put in there in order of priority, as I would see it, is physical activity. And the reason for that is because physical activity has been described as the miracle drug. And if we can, physical activity is about our walking, our stretching, whatever else we're doing. It's not about going to the gym. It's not about winning the marathons or anything like that. It is about building in, and you know what actually says, and getting that 30 minutes exercise into our lives. I cannot emphasize enough about getting that walk, that few steps into your everyday. Get out of your workplace. When it comes to lunch, don't sit at the table around there. Just actually get out, take a walk around the block, around your area. As much fresh air, as much physical walking that you have, really, really wonderful for you. There's online Pilates, yoga, strength and conditioning classes, and chair yoga for beginners, all available online. You can encourage that with your staff, all free to everybody. We run an annual Steps to Health challenge each year, and we encourage everybody to get involved in that. It builds great camaraderie, great prizes and all that goes with it. I also want to just to say to you, don't forget about the Selena Sloan routes. And they are developed with the Irish Heart Foundation, and I'm quite sure they're available to everybody, not just in relation to from the HC nursing homes or whatever, but they actually work with organisations in putting in routes around walking places or whatever that you have of walking. And of course, exercise, encourage that piece of take the stairs and avoid the lift if you have lifts. The other one I next bring in is about healthy eating, and Breffney referred to this as well too. So we know about the importance of our food, and there is now in place, which has been implemented, the nutrition standards for food and beverage provision, and that's for staff and visitors. And I'm just actually referring there to staff and visitors. There is, of course, one there in relation to our residences there. So one of the things in looking at and not being familiar with your environments to any great detail, but just look at what's the food in the canteens. You know, little changes can make a huge difference for there. So maybe it's because what we eat very much affects in relation to what our gut health is. It affects our brain health. It affects our sleeping. The same as physical activity is really good in relation to improving your sleep. And sleep, as you can hear, is now one of the critical things in relation to our health and well-being. And it's not just about the number of hours we get. It is about the quality of sleep that we actually get into it. If some of you have vending machines in your area, look at those vending machines and try to bring a balance and get away from the quick fixes of the sugar. And another key important things here, it's not just about what we eat, but it's about how we eat. And eating, of course, we know has that social connectivity, and where's the environment there, maybe for that cup of tea, the lunch breaks, the coming together. So it's good to look at those and talk and see how can we maybe make that more of a social outing and sharing. The other one I bring in then is smoking. And we know that smoking is a no-no. And we know that our staff smokes across the way. We know that 29% of the population currently smoke. We have a huge achievement made in people not smoking, and smoking kills thousands of people every year in Ireland. So to say to our staff, and this is the piece of actually encouraging our staff not to smoke, and more people have become interested in not smoking now because of COVID, because they see the correlation between smoking and the negative outcomes in relation to COVID. But to be aware that NRT is available there in relation to staff. Now, that is one that may not be available to private nursing homes, as Aisling has referred to there, but that's something that can actually be looked at, whatever. But available across the HSE is supporting your staff in relation to NRT. And one of the key things is smoke-free campuses, because we're getting feedback constantly from staff complaining about people smoking in the environment and they've been exposed to secondhand smoke. The other one is alcohol, and this is something that we don't want to discuss, and we sometimes move away from it. But we very much are aware of the fact that we all have habits of drinking that are not conducive in relation to being fit and well for working the next day at work. So if you just think about there, to encourage your staff ask about alcohol.ie. There's a lovely questionnaire on there that asks you just to look at, what are you drinking, when are you drinking, how are you drinking, or whatever. So if you take off, and people talk about the stress that's at work, but one of the things in talking about stress is how ready am I when I'm coming into the workplace for my day? Why is it that some days I can take things on the chin and I can move on, and some days they really impact me? But if I'm sitting up till 2 o'clock in the morning, and if I'm watching Netflix, and if I'm having my glass of alcohol, which might be the Galway tumbler, and I might actually have the bottle well drank before I go to bed, well, I definitely am not going to sleep well. I'm not going to have a quality sleep, and I'm not going to be ready and coming into work. So it's important in relation to, because we know the population uptake of alcohol and home drinking increased significantly in relation to COVID. So these are resources that are all available freely. There's a lovely measure in there. There's lovely tips and hints there in relation to. And of course, never forgetting that if staff have a tendency for alcohol, let's support them. I always remember the board alternate saying to me that how many staff we could have saved if we had jumped in and helped them, and people lost their jobs because we didn't interact in there. I just put in the sexual health in there for you from there, because not forgetting now that sexual health is important, because we all now have different groupings in our workplaces. So sexual health is not something that we should actually be moving away from or be afraid to talk about and look at and have the equality for our staff working in our workplaces, but happy to talk about that further. Other areas that are there is workplace choirs, and I put this in here because is singing and involving in choirs has been proved to greatly improve people's mental health and well-being. So across the HSE, there are many choirs being set up, and I encourage you that if you can, bringing together any groupings in relation to singing, and there are guidelines there for setting up choirs from those. Healthy meeting guidelines, that's well worth looking at, because as Breffney said, sometimes in the starting the meeting and taking that few minutes to kind of just pause and maybe just say, well, how are we as a group, or what's our triggers here today. The other one there is we are doing a lot of work now in the HSE back with Creative Ireland in arts and health, and we are working with Breffney's colleagues there with the Irish Hospice Foundation on a bereavement project. And this is, you might be familiar with the bereavement cafes that were taking place across the country. And this looked to see, well, how might we actually be able to do something from an arts perspective in relation to our staff? And that project is currently underway. We have 4 artists employed who are linking in with the Irish Hospice Friendly Hospitals and with Cole to actually see what might that look like. And there will be, and I say something because it's not identified yet what it will be, that will be made available and launched there in October, November, of being looking at how arts and bereavement can be linked together. Also want to share with you is that there are ongoing webinars that are take place, and we provide those through the HSE. They are available to everybody, and it's all about creating awareness. And the recording of the webinars are always done, so they're available at any time to look back. And 2, I'm just going to draw your attention to 2 lovely ones that are there. Positive psychology and happiness, because there's such huge information there about happy and why some people are inclined to be more happy than others, and how do we look at the glass half full and the glass half empty, and how can we build our happiness, and how can we actually move away from negative thoughts within our own mindset and build on those. And another one which is really interesting looking at is identifying your strengths to improve your well-being. So know, what are my strengths and my character strengths. The annual Christmas choir concert, I should have that, the annual Christmas concert that we host, and we love people to get involved in that and choirs to come forward. So keep an eye open for that, and I know some of your nursing homes did join into it. We have Healthy Ireland merchandise, so we're certainly open there to talking about if you're running initiatives or whatever else in there in relation to it. And resources are available on helppromotion.ie, and I will share with Roisin there the link and the steps for getting resources, because you can get available all of these resources that I have highlighted to you there through helppromotion.ie, and you can get as many copies as you want from them. Other popular initiatives that are coming back to us, and has come back from staff and investments there: garden seat, garden settings. They love outdoor spaces and building of that. Quiet places is one thing that staff really value from there. You will remember the days of when we had the oratories in the small little churches. Love people and going into taking those quiet places. Bike racks and bike shelters to help people to cycle to work, to get to work or whatever. So they're the ones that come out of it. I'm going to share this resource with you, and I'm almost finished now, Aisling, looking at the time. So I want to draw your attention to the Know Your Numbers card. And if you don't have this already, and if all staff don't have it, I'm going to encourage you, please do get it. There, you can have one for every member of staff. Have them around your areas, your workplaces, of course, for your residents as well too. It's an absolute wonderful resource. It's better than the lotto numbers, because if you're able to keep to those numbers that you have, your health will actually be improved from there into it. So it's a lovely little small accordion size breakout card. So that's one that you can get through helppromotion.ie. As Brittany was talking there in relation to from the services that we provide, and of course for ourselves there, and Roisin was just asking me about, all of these things that I'm talking about here in relation to minding your well-being and looking after your health and well-being, of course they apply in every way to the residents.
Sarah has just frozen. No, you're back again, I think, Sarah. Breffney or Roisin, has Sarah frozen for you as well?
Yes, she has.
Yes, she has. Yeah.
Okay.
No, I think she was coming to an end anyway, so
Yeah,
she may come back in. We'll just see.
Yeah, I'll just give her one moment. Yeah, she is nearly at the end of her.
Obviously, she has a lot of information and material, and really, different toolkits and all of that can help people. So, and as she said, they can be made available. So it's good for people that are on the webinar to know that, and we'll give them those links.
Yeah, absolutely.
There's a
Thanks,
couple of things in the chat there, Sarah, are asking to.
Yeah, apologies. I'll open that up now. So, okay, so dear Sarah, can you advise RE the perimenopausal menopause resources available? I'll get those to you guys afterwards. I can get them off Sarah, and I just popped in some links there in relation to different resources that Sarah was speaking about, but we'll also share Sarah's presentation afterwards as well, and there'll be links within that. So look, I might just wrap up there because I'm conscious of people's time, and we did say we finished about 12:30, and we've gone over that a little bit. So just wanted to say a huge thank you to everyone for your attendance this morning. And I want to say particular thanks to Roisin, to Breffney and to Sarah for your presentations and contributions as well. Thanks to everyone who contributed to the chat. And I will be looking through it again just to see if there are pieces that we need to go back to people on.
Yes.
And just to say that we are hosting a similar webinar this day next week, so Wednesday the 20th of July, and that is for nursing home staff. We will circulate out the invitation again, so if you could share that with your staff, that would be fantastic. And yeah, Roisin, if you'd like to add anything there at all.
Yeah, well, it's just, I mean, as you said, thank everybody. Thank you for your work. Thank you for taking the time today. And we will follow up. I think there are some things in the chat. Some are for us and for this group to follow up on. Others, as Breffney said, kind of fit elsewhere. And if we can give just any general guidance to people about that, we will do that. So we will do the follow up. If there's anything anybody would say in advance of next week to us, that, you know, put more emphasis on this or less emphasis on that or whatever for staff, we would also take that feedback, given that we're, you know, have had today with yourselves and then we're running another one next week. So any learning or kind of adaptation that this might benefit from, we'll take that on board as well. It'll all be linked back through with Aisling and Breffney back to the National CRT Forum, because that's where the request came from, and we certainly can give some feedback on issues that aren't purely for here back to there, and that'll be a channel for that. So again, thanks everybody. Take care of yourself. You have lots of pointers. Do acknowledge from a human perspective how it's been, and that's what today's space was about. And we're here if there's any help we can offer. And thanks to everybody, to Breffney and Aisling and Jackie on the call that have helped us to get this far. So do take care, and thanks again.
Thank you,
Thanks,
everyone.
everyone. Bye.
Bye now.
Bye-bye, everyone.